To remove a tumor that's located right in the front part of the brain over here, we have to do something called a bifrontal craniotomy. After going to sleep, the patient will be placed in a Mayfield skull clamp to keep the head absolutely still during surgery. And after some hair is shaved, an incision will be made from either side of the head, starting from one end of the ear to the other end of the ear. The incision needs to be large enough so that we can deglove the skull so we can work our way towards the superior orbital margin. At this point, a hole is made within the skull using a specialized drill. This animation does not show you that there's a very important structure that's located directly in the midline within the interhemispheric fissure. And in order for us to avoid hitting that structure, we have to make burr holes on either end of it. Comment if you know the name of this structure. Once the top portion of the skull is removed, we will then visualize the dura. An incision is made within the dura so that we can expose the brain tissue. And once the tumor is visualized, we have to perform careful dissection to separate the tumor from the normal tissue. Once we are able to establish a plane between the tumor and the normal tissue, the tumor can then be extracted. After the tumor is removed, we have to make sure there's absolutely no bleeding whatsoever. Once this is completed, we can then re-approximate the dura with stitches. Sometimes we will place a dural substitute or a collagen matrix that goes on top of the dura, and then we will put the skull back in place. The skull can be fastened with titanium plates and screws, and then the scalp is then re-approximated with stitches.